Hey everyone, this is Kester from Active Health Clinic. I thought I'd jump on here today and just do a quick video showing my kind of mobility warm-up routine. I do this before most of my workouts, but I also do it when I'm just feeling a little bit sore and stiff and like to get things moving. I'm going to aim for it to be quite accessible for most people, but obviously, you know, I'm sure there's going to be things in here that maybe potentially feel more difficult than others, and so it's really important that you consider your tolerance with this. The idea is that most of these movements aren't necessarily against a resistance aside from just your own body weight or gravity, but yeah, give things a go. Movement in this form can have a lot of benefits that can support people with invisible illnesses. I guess a few considerations to make is, so some of these, they're mostly dynamic warm-ups, so rather than static stretching where you're just holding a single position, and generally for people who have hypermobility, especially around their hypermobile joints, we wouldn't necessarily encourage static stretching, so just like holding a position, just because you end up putting potentially strain on the ligament of the joint by holding in that position. I prefer dynamic stretching, which just means moving through a range of motion, but there's lots of invisible illnesses that would benefit from movement like this. If we're thinking, dysautonomia and POTS, like circulation's a really important thing, and just by moving your body, you're supporting blood flow to different areas of the body. For people with chronic and persistent pain, generally reduced movement, like a general advice around pain is not remaining in the same position for a long period of time, trying to change your positions. That can be really helpful, and that supports blood flow and removal of waste products and reduced stiffness, so that'll be important here as well. So I'll get started. First thing, we're going to start in our back, and I think a good practice to do as well when you're about to start exercising is always checking in with your body. It's really common for people, if you're experiencing chronic pain or you're hypermobile, especially with the hypermobility, which is a bit counterintuitive, but people actually end up holding a lot of tension and feeling quite stiff, and this is, I guess, a kind of protective mechanism. If you're trying to avoid hurting parts of your body or having joint issues, you kind of move with a bit more tension, but because we're engaging in this, we actually want to try and notice and check in with that tension in our body and actually try and relax those muscles if we can before we get into movement. That can feel difficult sometimes, like a little bit vulnerable, but just work on it and just understand that with these kinds of movements, it generally should be safe to try and release some of that tension if you can. So start off with some knee rocks, and for these I do my feet together, knees bent at, that's probably about a 30-degree angle, and then hands just straight out to my side like a T. I usually keep both feet planted on the ground and then just like slowly rocking my knees side to side, and I get a nice stretch through my lower back when I'm doing this one, but for people that have really hypermobile spines, potentially that's not the case for them. They come right over and they don't really feel much of a stretch, but that's okay because we're still moving and getting blood flow to those muscles and warming ourselves up. So we're just going to go nice and slow back and forth. If at any point you start feeling pain or discomfort, just reduce the range of motion and just start with small rocks and then just slowly work your way out from there. Next one, we'll do this is called like an open book. You might feel more comfortable to have a pillow under your head to kind of support your head sitting in line with your spine. Our knees are going to come up bent, and we're just basically going to rotate our spine and open our arm up like that to the other side. You generally want to keep your knees attached to the ground. If I start to open up my body like that, my lower body and hips, I'm more trying to rotate and stretch my spine through this upper part. If that feels really difficult or you're feeling a lot of discomfort, just shorten the range of motion, just like this, and just slide one arm across the other. So I'm going to do both sides. I won't do it today, but I'd roll over and do the same on the other side. Next one, when I do my routine, I do bridges. So similar position to the knee rocks, but instead of my feet being together, I'm going to open up my base to about hip width, and just basically lift my hips up into the air like that. I'm thinking about I think the angle of your knees is important here. If your feet are all the way out here, you're going to feel that more on your hamstrings and your quads. When I do it for the purpose of warming up my lower back and glutes, I like to have a kind of more acute knee angle here, and I can kind of feel my glutes switching on as I do that. That can be regressed to just basically, like if I'm just sitting here relaxed, you can kind of feel a slight arch in your lower back as your spine does arch, and all we want to do is flatten that space. And that would be called like a posterior tilt, and then just a slight lift of our hips. So you're just mainly focusing on, you can probably barely see it, but just that posterior tilt of my pelvis rather than a full bridge itself, if that's beyond your capacity at this time. And so I just do, and for most of these, you can go anywhere between, there's nothing, if you can only do a couple of reps each, that's totally fine, but you can go anywhere from 5 to 20 really, and you can go beyond that as well if it feels really good and you're enjoying it. But just be conscious of your tolerance. We want to make sure these exercises are within your tolerance and they're not going to cause any post-exertional malaise. Next, I'm going to come on to like all fours like this. I want my center of like mass kind of nicely evenly spread between my knees and arms. So I don't want to be like too far back with all my weight on my legs. I don't want to be too far forward with all my weight in my upper body. Just a nice even spread. And I'm just going to basically do a camel. So you're flexing your spine like that and trying to create a curve. And I'm going to tuck my head, and then I'm going to go back the other way, and I'm going to try and extend my spine and then lift my head up. And I'm just going to go between those two positions like that. Once again, like especially for something like this, we don't want to be, if we're hypermobile, and especially if we're getting a lot of pain in our back, we don't want to go right to our end range, because we know with hypermobility, if you have that those elastic ligaments, those really elastic ligaments, and you push right to that hyperextended state, you potentially can kind of irritate those ligaments, and that might cause a bit more pain. So maybe shorten the range of motion to about 10% away from your end range, just as a rough guide. Cool. This next one, thread the needle. So I'm going to be in the same position, and I'm just going to bring one arm and like thread it so that I'm reaching across underneath like that. I might come this way as well, so you can see what it looks like from that angle, like that, and you should feel a bit of a stretch down your lat, and you can come right down like that. Once again, you can also just start small, and then you're lifting up like that, just like so, and then you switch over. Cool. Last exercise or movement is going to be just a soft kind of switching between positions of a child's pose. So sitting back like that to a cobra. When I come into this position, I guess I'm trying to get a bit of a stretch in my lower back, but also you can get it in your lats up here and even in your shoulders as you come down like that, and then back this way it's going to be more just in your lower back. Those last two movements are probably going to be the more difficult in terms of like the energy required to do them. So you can just omit those to begin with and start with the other ones, and then progress to there as you need. Cool. That's it. Thanks for watching.